One word of caution. When you're doing this technique, they can't see you. You're going to want to, for this to be effective, you're going to want to butt up against the pubic ramus with your forearm. So first of all, they're draped. You've got them draped in here, which is safe enough, but you always say to them, but I have to bump all the way up against your pubic ramus with my forearm. It's draped, but I want to be just telling you, is that okay with you? Get their permission, is that okay with you? And why is because when you get up to that pubic ramus, you want to rock along the whole pubic ramus, because it's not only the adductors you're affecting, but it's the levator ani. Remember that the levator ani has 3 different parts of that muscle that form the pelvic floor. The pelvic floor is the bottom of the core. The core consists of, recall, the transversus abdominis in front, multifidus in back, the respiratory diaphragm on top, and the pelvic floor or pelvic diaphragm on the bottom. And there's a way to test to see if the pelvic diaphragm is working by putting a thumb right off the ischial tuberosity and putting pressure and asking them to take a big breath. If they take a big breath and it does not push back against you, there is pelvic floor dysfunction on that side. It can be unilateral. You can have a pelvic floor that's working. The levator ani muscles on one side may be activated and they may not on the other side. Anytime they do episiotomies and things like that, they start doing stuff like that to the pelvic floor, you're going to probably have some pelvic floor dysfunction that's going to interfere with core stability. So it's very important. What I'm getting at is when we get in here with our forearms, we're not only trying to release all of these adductor muscles, but we're also trying to affect that levator ani, because you can get contact with that levator ani fascia and start to activate that bottom part of the core. Okay? So here we go. I'm kind of, I've got Terry's ankle again, and I've got it into the whole leg into internal rotation. And this can be a tender, very tender area. I come right at the knee again. I'm pushing those pineapples. She doesn't have them, but I'm pushing the pineapples back. And I'm getting a soft forearm, relaxing my hand so that the flexor part of my forearm is connected with her fascia. I get a fascial hook, and I slowly start to traverse headward, this time with no enhancers. I'm not using any enhancers. She's not doing any movement at all. I'm just slowly gliding all the way up to the pubic ramus. If your arm isn't as long as mine, which many people aren't, you might want to take a couple of swipes at it. You don't have to hold this back here if you don't want to. So when I get up to the pubic ramus, notice how I'm just rocking back and forth. I'm rocking back and forth on all of those tendons at the pubic ramus. This really stimulates tone in that pelvic floor, so you can test it before and after to see if you've activated levator ani. And my lumbar lordosis locked in, and I'm pushing off my back leg. Do not muscle them. Don't use your shoulder or arms to muscle them. Push off with that back leg. My left foot's doing all the work here. Notice how my whole body is rocking. That's all you have to do, is to just keep the person grounded by letting the energy go all the way around and through and up through your spring system